Welcome to Every Mom is an Athlete, the podcast where we believe motherhood is inherently athletic. From lifting car seats to chasing toddlers, your daily life is a workout. I'm Dr. Karlie, pregnancy and postpartum expert, sports chiropractor, strength coach, and mom of 3. This is your space for strength, recovery, and real talk in pregnancy, postpartum, and motherhood. Welcome, Strong Moms. You're in the right place. Hello, Strong Moms. Welcome back. Okay, we are in week 5, our final week of postpartum pains. Today, we have our C-section edition. And we are going to talk about C-section recovery, whether you have one coming up, or you just had one, or you had one years ago and you're still having issues. I want to give you some real tangible tools that you can use, whether it's been just a few weeks or a few years, because here is the truth. C-sections are major abdominal surgery. And yet most women get very little guidance on how they can actually recover. So let's get into it. A C-section is major abdominal surgery, and yet most women are sent home with so little guidance on how to actually recover from it. So let's talk about some of the things you can do early on if you are planning or have recently had a C-section. And we're also going to talk about things that you can do years later if you're still experiencing some discomfort or pain and you think it's due to your C-section, because let me tell you, it might be. We'll talk a little bit more about that too. So first of all, just a little background on my C-section. My second son was breech, and so I did try everything under the sun to get him to try to flip. He did not, and so we had our scheduled C-section plan, and I had truly a great experience. I've written blog posts. There is an episode, I'll link it below, on having a gentle C-section and how you can request that and some of the things that you can do to make it feel just a little more like the natural birthing process. I really did not want to have a C-section. I never had surgery. I was really not into it, but I really did come to a peaceful place about it, and I had a great experience. And now I'm actually very grateful because I'm able to help so many more moms recover and get strong again after their C-section and truly understand what they're feeling. So let's get into it. Let's talk about those first few weeks after you have a C-section. So what you might be feeling, you might have pain around the incision or tenderness. You might feel burning or pulling or just like a tight sensation around your scar. Some women, I know I had this, like you have some pain or difficulty with standing up or like transitional movements, from like laying down to sitting up or sitting to standing, that sort of thing. I know my doctor had me use a pillow and kind of put that over my C-section scar if I coughed or laughed, just to support the scar. And I know that was helpful for me. I think that's pretty common advice. So I hope that you have had that. But if you didn't, now do that. And then also just feeling very weak in the core and just like everything is wobbly and unsupported, and because it is. And I like to remind women, so before the baby comes out, you have to remember that your spine is actually much more stable while the baby's in there, right? Your organs have all shifted around. The baby is taking up a lot of space. And so everything is very full. Like it's a very stable position for your body to be in. And then the baby comes out and now it's like, whoa, there's like a big space, right? And so your organs have to shift back. And it's just a very unstable, unfamiliar, wobbly position to be in. And that is very normal. I like women to know that. You are not like the exception to the rule. It is so normal that first week or two to feel like the very weakest and unstable in your core that you have ever felt. And for me, just like knowing that was helpful and being able to expect that. And I always make sure to tell all my athletes in my office that I see who are pregnant, listen, this is going to be the very weakest you've ever felt. And if you know that going in, then you know, okay, this is normal. We are going to get stronger soon. We're going to start our breathing and our bracing right away, and we're going to build back. Okay, back to C-section. So one thing that a lot of women don't expect after a C-section is having a lot of numbness around the incision, and not just like on the incision, but around it, because you have to remember the nerves are being disrupted during surgery. They're being cut through, okay? And so your body is protecting that area, and nerve regeneration is actually quite slow. And so that is one of the things that comes back last. For some women, it doesn't always come back completely normally, but there's a lot of stuff you can do. We'll talk about that in a minute to really start kind of waking that area up a little bit. Since your body is trying to protect it, what some women will end up doing is like holding their breath, or they'll like brace really hard, or they'll avoid using their core at all. And so this can slow down recovery if you end up kind of doing this as your default. So I just mentioned that to say that if you've just recently had a C-section, just be aware of those things. Those are just kind of compensation patterns that your body is doing to protect you. But really, we want to get out of those as soon as possible. Another question I often get asked is about belly bands and abdominal binders. I should do an episode on this because I am very anti abdominal binder. I really want people to use, especially like newly postpartum, I want them to use their core and use those muscles, except for in a C-section for that first week or two. I think it can help. I have seen in so many patients, I've seen the research that it does help with inflammation. It helps with just taking a little bit of pressure off of the scar. So we're not talking about like this crazy tight thing that, you order off of TikTok. We're talking about the waist wrap that they might give you at the hospital. You can ask for that just for a little support at first when you first go home, as you're getting used to holding your baby, as you're healing and all that sort of thing. So let's talk a little bit about scar mobilization before we get into more C-section talk. So this is one of the main things that I do with my patients who come in who've had a C-section. And also, by the way, in my C-section postpartum plan, there's a whole section on how to do this, the steps to go through it, when to start, all that sort of stuff, because I just think it's really important. During those first couple of weeks, you really are letting the scar heal. So weeks like 0 to 2, I really have women focus on diaphragmatic breathing. You can do some of the deep core engagement. You're working on posture and making sure that you're like using your best posture so that you're not like putting additional pressure on the scar. You can do some light touch. So sometimes I'll have women do this, and I did this on my own, some light touch around the scar, but not on top because it really is still healing. You want to just like leave it alone. So what you can do though is like around, you can use your fingers and just kind of like lightly, very lightly rub, just kind of like to wake things up. You're just trying to give your system some input and say like, hello, try to like desensitize the area a little bit. As long as your incision is fully closed and it's healing and there's no redness or infection or anything like that, from about the 2 to 6 week mark, you can start doing some just like really light work around the scar and even on top of the scar. So usually what I have people do is we're not like digging in yet. We're not massaging. You're just touching lightly around the scar. Sometimes people will use like a different texture. So like a little like washcloth or something just to start again, getting some sensitization back into that area. You're sort of trying to tell your brain, you're like decreasing sensitivity to the area and you're making your brain comfortable with like, okay. It's okay to be touched here. Yes, we had surgery, but we can touch this area. It's fine. And then once you get past the 6 week mark, that's when you can really start working on the scar. So when you think about scars, the layers of tissue are all like, they end up binding all together where, if you take your arm and you kind of like rub the skin on it, you can see that it like, it goes all different ways and the different layers move independently. When you have a scar, especially a surgical scar, which has been cut, the tissue layers all kind of like wrap around together. And so what we're trying to do is move those so that they can move a little more freely. Scar tissue does not lay down as nicely as like regular collagen fibers. It's not all nice and linear. It's kind of all like a mishmash of messiness. And so what we're trying to do is basically like realign some of that tissue around it so that it can move a little more independently. So what can you do here? You can do circles around, you can go up and down, you can do some cross friction, but you really do want to get that scar moving. It may be a little uncomfortable, but it should not be painful. You can also, if you're working with a chiropractor or a pelvic floor PT, you can also ask them to do some of this work on you. Some women are really sort of weirded out by touching their own scar, but I really like to try to encourage those women to start doing a little bit on their own as well, because it really does need to be done pretty consistently. It's not like do it once every week or two. It's really more like you should be doing this sort of thing daily, but just for a couple minutes. So being really consistent with it. So what other things should you be doing early on after having your C-section? So I mentioned before the breathing and the bracing. And again, this can be done, honestly, this can be done as early as within the first week if you want. My C-section plan starts at week 2, just to give people a little time to really just let things heal. But again, it starts so gently that you can start at week 2. You're not even cleared from your 6-week appointment yet. Don't get me started on that. But it's so gentle that you can be doing some of that stuff early on if you feel ready. Now, you're not doing crunches, you're not doing planks. We're working on the deep core and we're working on the breathing and the engagement of the pelvic floor with the breath, all of that working together at first. The other thing we can do is really start using some smarter movement strategies. So we're not just going to sit straight up out of bed. Okay. Our abs, our core might not be ready for that anyways, but especially when you have a scar there, it's not going to feel great. So rolling to your side, pushing yourself up out of bed can be really helpful. And then just making sure you're avoiding any kind of unguarded or jerky movements at first, within those first few weeks, especially, can be really helpful. It really does drive me crazy that you would never go have like ACL surgery or any kind of like knee or shoulder or hip or any kind of surgery without a very succinct rehab plan. Like if they didn't give it to you, they would say, hey, go see this PT. This is what you're going to do. You need to be doing this plan for 3 to 6 months or whatever it is. But yet we do abdominal surgery on women, pull a baby out of them, and then give them no guidance on how they're supposed to recover from that. It is so wild to me. So anyways, I could go on forever about that. That is why I developed my whole C-section plan, because I'm like, there has got to be a plan for C-section moms that understands what they can and can't do. So it eliminates certain things. Like I'd already built my postpartum plan. And as I was going through my recovery after my C-section, I was going through that plan and I was like, nope, can't do this. Nope, can't do that. Some examples are like, Superman's, like you can't just lay on your stomach, right? At 4 weeks postpartum, it still does not feel good. So there's other ways to engage your low back muscles, engage your glutes, do some of those things that might not feel good if you had a C-section. So what does it look like if you had a C-section and months or years later, you are still having pain? So sometimes what I see is persistent low back pain, core weakness, or doming or coning still of that abdominal separation that was never addressed. Pelvic pain, scar tightness or sensitivity, or just feeling like disconnected from your core or your abs. So I've heard women say like they feel like they can't access their lower abdominal muscles or they can't get them to fire no matter like what core exercises they're doing. Sometimes that can be, if you had a C-section, because of that C-section, right? Because maybe there wasn't much rehab done. Maybe you weren't told what you're supposed to do or that you didn't know you're supposed to mobilize your scar, all this kind of stuff. But the thing is, it's never too late to make some improvements on that. The other thing I have seen is low back pain. Often in my clinic, I always, of course, do a thorough evaluation and exam and history, but I really want to know if they had a C-section and what the recovery looked like. Because if you imagine you have this big scar on one side of think of your core as like a barrel, right? It makes sense that if that tissue is all bound up and tight there, that the other side of the barrel, which would be your back, would be having some issues because it's been compensating for months and months or years and years, who knows? So that is one of the things that I always checking into and looking at, okay, could we mobilize some of that scar tissue? Can I teach you to do it at home? And then how can we strengthen the muscles on the backside that are also supporting you? All right. So the good news is it really never is too late to start focusing on these things. Later recovery, so let's say, years later, let's say 2 years later, your toddler's 2 and you're like, I never did anything. What am I going to do? You're already back exercising. You're doing most of the things you want, but you never did any specific C-section recovery and you are having some issues with your back. What do you do? What I would have you do if you were a patient in my office is that we would really examine how your deep core is working. Are you able to engage your transverse abdominis? Are you able to keep your back in a neutral or flat position when you're doing core work laying on the ground? Did you ever do any scar mobilization or desensitization or any of that stuff in that tissue? We can do some of that. And then we have to build up strength again, right? We have to build up strength in those muscles. We have to have progressive overload and really focus on making sure that your core is able to hold you nice and stable even once your scar is healed, because it is going to change how things are moving in that area, in the low back and the pelvis. So if you've had a C-section, whether it was 6 weeks ago or 6 years ago, and you're still having pain or weakness or things are just feeling off, I created my postpartum C-section plan exactly for this. It's a step-by-step program designed to help you safely rebuild your core, improve mobility around your scar, reduce pain and compensation patterns that you might have built up over the years, and to get you feeling strong again. I will put the link in my show notes here, but just know that it is never too late to make changes to these and to get strong again and to address some of these issues that might be even years old. It's never too late. All right, strong moms, I hope this is helpful. Please share with a C-section mama that you love. And I can't wait to be back talking with you next week. Thanks for listening. Every Mom is an Athlete isn't just a podcast. It's a reminder that you're still the athlete you've always been. If this episode resonated with you, I'd so appreciate it if you'd share with a friend or leave a quick review. It helps more moms find the support and information they need. See you next time.